coming today. We have Cheryl Leary, who some of you may remember. She was here a couple months ago for the talk about the healthcare proxies for Pizza and Proxy. And she's back today to just talk about HESCO in general and all the programs and services that they have to offer. Walpole Media is here today, so if you have a question, just raise your hand and Cheryl will either bring the microphone over to you or repeat the question so it can be heard on the recording. Thank you. Thanks, Cheryl.
Hi, everyone. It's so nice to be back. You guys always have such a nice group here. I love coming out to this particular Council on Aging. You guys are so vibrant and active here. It's great. So, as Debbie said, I'm Cheryl Leary. I'm the Director of Planning and Community Development at HESCO. Been there, all told, more than a decade. So, I love this agency and am looking forward to being able to share information about it with you. So HESCO is the Area Agency on Aging and Aging Service Access Point, and I'll explain what those things mean. So the Aging Service Access Point essentially is sort of that state-funded arm of what we do. It's the state comes in and helps us provide the home care services for people. So when we refer to either people call it an ASAP for sure or Aging Service Access Point, that's usually something that is like a state-supported program. And then we're also the Area Agency on Aging, which is actually a federal designation. So the Older Americans Act, originally passed back in 1965, I believe, that gets reauthorized every few years, mandates that there's an Area Agency on Aging for every city or town in the country. So we handle these 12 towns that you see that are slightly more gray on that map. And it's pretty much sort of that Dedham down to Plainville stretch. So the 12 communities. We are also part of the Metro West Aging and Disability Resource Consortium. And what that is that's a group of both aging services and disability services organizations that have kind of combined forces to kind of make sure that we're working together, we're communicating well, that if somebody goes in and speaks to somebody at the Disability Services Agency that they know if they're over age 60 to send them our way, and the same for us. If we know if we have somebody under age 60 living with disability, we know how to send it to their agency. So it's just a really great way for us to make sure we're all connected. So I'm going to talk about sort of these specific programs just to kind of make sure that these programs are the ones you walk away from here knowing about. I do have information sheets that are available that do list out a few more other things that I probably won't have time to talk about because we have a lot of different things that we offer, but I think these are the main things that most people want to hear about when I go out and speak. So we're going to start with home care services. So these are services that are designed to help older adults live independently in their home. As I mentioned before, this is part of our state-funded program, so the state does subsidize this program. And the services that we can provide include things like personal care, housework, medication management, emergency response systems, access to adult day health programs. So what happens with within the home care services is that an assessment has to be done in the home. So HESCO would come out to determine eligibility for the services. Your eligibility is based on how much help you need with things called activities of daily living. Activities of daily living are things like bathing yourself, dressing yourself, getting yourself meals, getting yourself your surroundings clean, your housework, your laundry, your grocery shopping. Those are all considered activities of daily living. So for us, a care manager or a geriatric services support coordinator would schedule time to come out, do an assessment, and determine if you meet the eligibility for that state-funded program. Now, the cost of home care services, that's another question that we get a lot, and it's not something I can easily define for you. It's actually on a sliding fee scale that is based on the income of the person receiving care. Okay, so there might be some people who might have a very low income, and they might not pay anything at all for services. And we might have some people with a moderate income who might pay $52 a month for services. And then we might have some people with a higher income, and their copay might be a percentage of the cost of their services. So if we're putting in $400 in services per month, they might pay 50% of that, or they might pay 75% of that, all the way up to 100 if you're in those upper brackets. So that sliding fee scale is set by the state. Every year they come out with a new scale. So there's sort of no way for me to say to you, this costs exactly this, because it's actually going to be based on your individual circumstance. So can I ask you right now, are there any questions about home care services? Yes. I'm going to come by and give you the mic.
Are the services, if you're living independently in your home and not in a independent living institution or something? Or is this just for people who live on their own at home or in an apartment situation?
Sure. So the question is it just really for people who are living in an independent situation, an apartment or a private home? And yes, it is. We actually do not go into assisted living programs. If something is called independent living, then depending on the type of independent living it is, we might go in. But if it's one of those independent livings where they have different levels of care and they do offer that assisted level, if, you know, generally we wouldn't be going into those facilities.
So you're saying, though, that if someone's living independently
Mm-hmm.
and that particular place does not offer those services as part of their rent or whatever, then there might be an opportunity.
Correct. So the question is, if you're living independently and where you live does not offer any type of services like this, is that when we can come in and do that? Yes, absolutely. Any other questions? All right, I'm going to talk about the next program. Protective services. So protective services intervenes in situations where there is self-neglect, abuse, exploitation, or neglect that are impacting older adults over the age of 60 and putting them at risk. Okay, so what happens is if we get a report and we decide that the information sounds like it's something we need to investigate, it gets what's called screened in. And we would have a protective services worker who would complete an investigation. And if the allegations are substantiated, then what they would do is work with that older adult to try and develop a service plan to keep it from happening again. That might be changing the living situation. That might be going in through different court systems, or, you know, involving even the Attorney General if it's serious enough to include criminal charges. Or it could just be setting up services because a caregiver is really just overwhelmed and it just led to a bad situation. A lot of things can happen, and so we have a lot of different range of options and services and supports that we might offer somebody if the allegations have been substantiated. So in the state of Massachusetts, we have a statewide number where any concerns that you might have about an older adult who might be abused and financially exploited, or emotional or physical abuse or sexual abuse, or they're neglecting their own care, they're self-neglecting, and they're really not taking care of themselves and they're putting themselves at risk. This is the number you can call, 1-800-922-2275, 24 hours a day, 7 days a week. You can also make a report online. It's on the Massachusetts state website called mass.gov. You can find it there. So it's just important that we all have our eyes and ears open and that we're taking care of each other, right? So I always want to make sure I'm mentioning this and that you know how to take action if you need to. Any questions about that? Okay. So we're going to move on to the nutrition program. And actually, many of you in Walpole, this might seem pretty familiar because one of our meal sites is actually located here in your kitchen. So we love having a meal site here. The Meals on Wheels program offers a hot meal over the noon hour. Usually somewhere between 11 and 12, the meal would arrive. The meals are delivered by volunteers, and the volunteers also provide a safety check. You know, they're sort of a level of eyes and ears on the ground, right? They're knocking on the door to hand somebody a meal, and if things don't seem right, they report that back to the meal site manager who works for HESCO, and then we kind of go through a process to make sure that we know that that person's okay. It might involve us calling them, it might involve us calling family, or even if we can't locate them, they never answered the door for their meal, we might even call the police and have them do a well-being check. So it is a safety system as well as providing a nutritious meal that meets 1/3 of your daily nutritional intake. The Meals on Wheels is appropriate for anyone over age 60 who is considered homebound, meaning they really can't get to a center like this for their meal, or they can't get to a grocery store, or they require some type of assistance with meal preparation. So anyone age 60 and over. And in some communities, HESCO can offer meals for people under age 60 living with disability. That is paid for through the Metro West Center for Disability, Center for Independent Living, excuse me. And unfortunately, they don't cover Walpole. So that's not available here in Walpole, but it is available in some neighboring communities. And if you have any questions about that, I'll be glad to let you know if a different community is involved.
Why is that it's not done here in Walpole?
So the money that Metro West Center for Independent Living is using and to pay for this service was part of a larger pool of sort of the COVID relief funds that agencies like ours have all gotten. And so their territory that they cover just doesn't include Walpole, but they've chosen to use some of their money to help consumers through the HESCO Meals on Wheels program. You know, so it's different agencies deciding how to use funding that they've gotten from the federal government, which has been an unusual situation. Prior to that funding coming down, we were never able to offer under age 60 meals. So, you know, we're really pleased that we can, even though it's not in all of our communities. The Meals on Wheels is a federal program too, and I just want to make sure you know that you are never required to divulge your income information, and we don't actually charge a copay for that. It's a voluntary donation per meal if you're able to. You would never be restricted from receiving the meal if you were unable to make a donation. But also within our nutrition education program, we have a registered dietitian. Actually, her name is Kelsey McEntee. And she can meet individually with people over age 60 who may have questions about healthy meal planning or maybe managing a chronic illness, you know, with better nutrition, because we know how much nutrition impacts our health, right? So it might be really important to sit down with a registered dietitian. And, you know, she can really go over creating a nice meal plan, creating shopping lists, helping to figure out sort of what the challenges are that you might be having. And she also provides programs at Councils on Aging. So I'm sure at some point she will be here and providing a nutrition education program. It's pretty common that we go out to all 12 of our communities and provide programs. And again, there's no cost for this service. It's the same as with some of our other federal programs where it's on a voluntary basis if you want to make a donation towards the cost, but there's no requirement to. I'm going to talk about the SHINE program next, but I think we have a nutrition question. Yeah. You want the
Does the nutritionist have papers on different diets? Oh, that's great. That's great.
Absolutely. She has handouts that she can provide, and she can even create something that's personalized for you if the sort of generic handouts need to have a little more information based on your situation. Um, she absolutely has, yeah, a lot, especially with like chronic heart failure or diabetes or any of high blood pressure, any of those conditions, those chronic conditions that people have that are really your nutrition impacts directly. She absolutely has materials. All right, so now I'll go on to the Shine program. How many of you heard of Shine? Because that's something that people hear about. So a lot of people know all about the Shine program, but it is just a phenomenal program. It's free, unbiased Medicare health insurance counseling to help you find the insurance plan that best meets your need. Okay, so it's really geared towards Medicare beneficiaries who just have questions about what Part D plan should I have? Should I be in a Medicare Advantage plan or a traditional Medicare? Any of those health insurance questions that you might have. But we also here in the state of Massachusetts, we do also deal and help people if they have questions about Mass Health, which is a different type of benefit than Medicare. It might be referred, you might have heard it also called Medicaid. So we can really help with any of those types of insurance questions. And this program is really driven by volunteers. And you guys do have a dedicated volunteer here. I was trying to think of his name before. Is it Marv? Yeah, okay, it's Marv. So you might see him around, and during open enrollment, which runs usually from, I'm going to have to try and figure that, October 1 through December 7th, I think is what open enrollment usually runs between. And you can set up individual appointments with him to go over your Part D plans. It is so important to do that because, as crazy as it sounds, what these Part D plans will cover changes from year to year. They change what's called their formularies. So what medications are included in their formularies that they're going to pay for and how much the copays are, that changes every year. And that open enrollment is your time to make sure that the plan that you're on is either the right plan for the medications that you take or if you would be better served under another plan. So that's why it's really important to kind of connect with that Shine program. And I think that's why so many people always know about Shine when I go out and speak in public because, you know, if you've been, especially if you've been over 65 for a few years, you kind of know the drill, right? You have to do this every year and try and figure out what's the best plan for yourself. And again, this is a completely free service. I'm going to talk next about the Family Caregiver Support Program. So this is a program designed to help family caregivers or anyone that's caring informally for a person, so someone who's not a paid caregiver. It helps them figure out sort of what's happening with their situation to really help them come up with a plan, an action plan to alleviate their stress, to help them figure out how to connect to resources, to try and connect them and expand their network so that they get more support. And it's really something that is driven by the caregiver. It's meant to empower the caregiver to really think about their situation and to really figure out what would help them get through this phase of life, which can be very hard when you're caregiving for another person. The family caregivers that this program helps are people who are under age 60, but caring for somebody over age 60. So perhaps like an adult daughter or son who might be caring for a parent. It would also help somebody over age 60 who's caring for actually it helps somebody over age 55 who's caring for an adult with disability. So anyone over 18 who has a disability. So a lot of times a parent might, as they're getting older, they might want to get a little bit more support if they're caring for an adult child with a disability. And it also helps people who are 55 and over and raising a grandchild or another ward under the age of 18. So grandparents raising grandchildren, or other family members, grandparents who are raising other family members' children. And that's a unique group that needs a lot of support. And so this program can help any of those types of caregivers. And I have to say, this is, I think, one of our most critical programs, because when you're a family caregiver, it can be so isolating. And sometimes you don't know what's out there, but you're so entrenched and so busy with what's going on that you don't even feel like you can get out there and look and see. And I feel like this program is one of the few times in the whole kind of system of care where the caregiver is the client. So our caregiver specialist considers that caregiver that they're talking to their client. And that's like the only time that caregiver has that very specific advocate, because usually most people are going in for the care recipient, right? They're going in to provide services and doing evaluations on that care recipient, and the caregiver's kind of off to the side. So this is that time for that caregiver to get that individualized support. This is also provided at no cost, and there are no types of income requirements whatsoever. And so it's available for family caregivers if the caregiver lives in Walpole or any of our HESCO towns. And even if they're caring for someone outside of the community, that's fine. Or if the caregiver lives outside our territory and they're caring for someone in Walpole. So as long as one person in the relationship lives within our territory, we can provide that caregiver support. We also run a virtual caregiver support group through this program as well that meets twice a month. We started that during the pandemic, that really felt that caregivers needed an outlet. And we have continued it virtually because the group has wanted it. And part of that is because by starting it virtually, we had people from all different geographic areas coming on. So now there wouldn't really be one good place for us to meet in person. So they've opted to keep it meeting virtually. Any questions about this program? All right. Options counseling. So this is a program that provides informational counseling, anyone age 18 and over, who really requires some type of long-term care and support. Generally, it's more often for people who are trying to figure out how to stay in the community and they need to know what services are available to them. But it can be really anything. It's really about figuring out what the person's individual goals are and helping them figure out a plan and how to connect to care. That options counseling meeting will go over sort of what their functional needs are, you know, those activities of daily living, find out what they need help with, would review their options, would talk about the cost of that care, and give them the information that they would need to be able to connect to that care. So it's not really any type of long-term type of care management service, but it provides that initial connection, information and connection that people need. And of course, people can come back in and get it a second, third, fourth time if that's what they need. There's no limit on how often you can meet with an options counselor. And there is no cost for this service and no income guidelines. Any questions about that? All right. Transportation. So transportation is a complex topic. And I'm just going to let you know, here in Walpole, you are so lucky. They do so much transportation here out of the Council on Aging. And I hope that if transportation is a need for you, that you've been able to connect with them here, because really they provide a vital service. So the way that we have worked our transportation program at HESCO is we ask all of the local councils on aging to work with us and to really actually fulfill the rides as much as they can locally. So with their van services, because we cover 12 towns, and each one of them has some type of van service, some level of transportation within their community. And we want people to be connected to that, right? That's a great source. It's a long-term source of support, you know, and it's something that's important to get you connected. And then if the Council on Aging cannot fulfill a ride, especially, for example, they might not be able to take you to Boston for a medical appointment up in Boston. That's probably what we get most frequently for requests. Then the Council on Aging can call it into HESCO, and we will work with our transportation vendors that we have contracts with to set up that ride. And then the Council on Aging will let you know, so-and-so is going to pick you up at this time, then the return trip will be at this time, and that's then paid for with the money that HESCO receives from our Older Americans Act money, our AAA, Area Agency on Aging funding. So it's still something that you access through the Council on Aging. So that's where I ask you to kind of start your process. If you're looking for transportation, start here at the Council on Aging, and then they will work with us if they can't provide you that ride. So I think you have a new outreach worker right here that's going to work with Laurel. Do you want to just say your name and wave to everybody?
Jillian, I will be working with Laurel. I will be 2 days a week. Laurel will be 3, and we'll be working closely together in the outreach office. So stop by and say hi.
So Jillian, she's going to work with Laurel, and they're going to combine between 2 and 3 days each, covering that office. So you're going to go to Jillian and you're going to go to Laurel when you have a transportation need and get started with them, and then they'll work with HESCO if it's not something that the Council on Aging can provide. Any questions about our transportation services? All right. So sometimes when I go out to communities, I like to do things that are very specific and give information specific to just your community. So I think that sometimes people listen to presentations and they think, oh, I don't know who gets that or who would need that. And I'm not sure that that's for me or that's right. But I do want you to know that in Walpole, we provided 19,675 hours of chore, companion, personal care, homemaking services for 73 Walpole residents. The cost of our negotiated rates with our vendors of all that care was $544,902. You know, and as I said, there might be some people that have no co-pays, and there might be some people paying a percentage of their of the cost of their services, and the state would be subsidizing the rest. So I think it's important for you to know that people do need this service. It is here in Walpole already. It's available, and it's something that if you do need care, that we do want you to be calling us. In 2021, we also provided 217 Walpole residents with 21,283 meals. So again, we're providing a lot of nutrition support here in Walpole, and it's something that if it's something that you think you need or your neighbor needs, please give us a call. And then we did provide 10 residents with 129 one-way rides. And I have to say, that's actually a low number compared to some of our other towns. And the reason is because you guys have such good transportation here that they don't often have to call HESCO as much as some of the other towns. So please consider yourself lucky that you have this Walpole Council on Aging staff and team that are devoting all of that. Yes? What would a one-way ride be? So we just refer to it that way because some people might only need a ride to the doctors and maybe somebody else is picking them up. Sometimes they need the ride both ways, so that would just be 2 one-way rides. Okay, so we just refer to it that way. That's sort of our system lingo. Okay. Any other questions? All right, so that's sort of what I prepared for you. I'm happy to stay and answer questions about any type of services, or if there's something I didn't talk about that you want me to talk about, now's your chance. So, any other questions or thoughts? All right, I'm gonna start down here.
So if any of those services are services that you would want to look into, who would you contact? How would you get started?
I'm going to show you that. I'll put that up on the screen next. We have our information and referral department, and we have an email. I saw another question.
Yeah, I guess this is under transportation. I have somebody that wants to be able, who can take care of himself, but he's limited. He would like a ride to a mall to walk. Is that something you have to do through a private agency?
That's a really good question. So we get such limited transportation dollars that we actually limit it to medical transportation. So that's for any HESCO transportation is very specific to doctor's appointments. But there certainly are other options for transportation here. Sometimes through the Council on Aging, they might do group transportation to different places. I don't know if they go to the mall. I see some people are nodding yes that they go to the mall. So maybe sometimes it just means adjusting your schedule. If the issue is that somebody has to be with him, then yes, that is something you have to do through a private agency. Yes. Any other questions? All right, so I'm going to put up on the screen how to get in touch with us. So 781-784-4944 is our phone number, and that if you are not already in the system or a client of ours, the best place to start is usually our information and referral department. And then we also have the email info@hesco.org. So I would definitely encourage you to call. I think it would be hard for me to have any type of public presentation right now without mentioning that across the country and here in Massachusetts, there is a shortage of direct care professionals. So the people who are doing the work out in the homes, home health aides, personal care workers, homemakers, there is a real shortage across our state. I will mention that if anyone here is interested or may know someone who's interested in entering that field of work, the state has put together an online training program. So that's something to investigate because it could be a really nice and low cost way to get that training and be certified. But it is something that also impacts the people that come to us. And I do want to just let people know that sometimes, even though I'm talking about the services, sometimes people do have to wait, because of that. We have to wait for somebody to become available, to have time in their schedule. I still encourage you to enroll for the services because there are other things we might be able to provide. For example, we can use laundry services as opposed to a homemaker to come into your home and do laundry, which there's a shortage of those homemakers, but the laundry services that come, they pick up your laundry, take it, and then do it, and then bring it back within a couple days. We can put those in. We can always still put in emergency response systems, the Meals on Wheels. So there are things that we can do right away, even if we can't do everything. So I would still encourage you to enroll for services and definitely get your name on the list for people waiting for in-home care if you need it, because eventually we know we'll get there. Hopefully things will improve. We've already seen some improvement in the state, but there's a lot that has to be done to really get to the point where we need to be. And unfortunately, it's not just happening here in our local area. It's happening in the state. It's happening across the country. So any questions about that? Yes.
The laundry, how does that work?
Okay, so the question was you're interested in the laundry.
I'm just saying,
Yep.
how does that work?
Sure. So if you are eligible for our services, which means that you have enough level of impairment that the state says that we can provide the care, a laundry service would come and could pick up your dirty laundry. You have like a special bag that you're given. You can leave it outside in front of your door. They will come and pick it up, and then I can't remember the exact turnaround time, but I think it's like 3 days or 4 or 5, 4 days. They would return that bag to you with clean, folded laundry. Any other questions? All right. Well, you guys have been great. Thank you for all your questions. I really appreciate it. I love coming out here. Thank you.